Right, hi folks, thanks for tuning in once again today. I'm just going to do a quick vid on something that might help people that suffer from lower back pain or in general might have some type of postural imbalance. So I'm going to be talking about anterior pelvic tilt. So first off, I'm a little stick man drawing here. I'm real artistic. So with normal hip alignment, we're going to use some reference points. So first off, we use the posterior superior iliac spine and the anterior superior iliac spine. So just PSIS or ASIS, simplified a bit. So with that, we're basically looking from, let's say that's posterior, and that's the anterior. So drawing a line horizontally across, and then one straight to the, shocking, not real straight. A bit better. So with males, between those lines, looking for about an 8 to 10 degree angle, and with females, because of different structural makeup, we're looking for about a 10 to 12 degree angle for a normal hip alignment. So where the problem occurs is where people go further into an anterior tilt. So the ASIS will shift inferior more to the PSIS, and therefore that obviously that angle will increase. So I like to sort of call it Daffy Duck syndrome, where us sticking out, he's sort of quacking along, sort of thing, or you might see him like Kim Kardashian or something with freaking ass sticking out. So it will be the anterior tilt of the hips, and that will also increase the lordotic curve in the lower back. So if you suffer from lower back pain, this might be a fix for you. But first we'll just address some of the key muscles. So looking at the back extensors, the abdominals, hamstrings, and hip flexors. So when there's an anterior pelvic tilt, more often than not, the extensors will become short and strong. The abdominals will become lengthened and weak. And then the hip flexors will become shorter and strong. And the hamstrings can be longer and weak, or sometimes they can still be strong and long, but and generally, they might be long and weak, but it can vary. That gives you the basic idea of how there's going to be a rotation happening in that order, which is shifting that pelvis in a clockwise direction, looking from there. So what can you do? So first off, you're going to want to stretch the tight muscles. So stretch the hip flexors and stretch the lower back, or if you have a good massage therapist, or use a foam roller. So try to release the lower back with foam rolling. You can also do that on hip flexors as well, on the quadriceps. So we're trying to stretch the muscles that have become strong and tight, and trying to strengthen the muscles that have become long and weak. So especially the abdominals, like the core, trying to strengthen that to help re-establish a better hip alignment. So first I'm going to show you a quick stretch. So just in a basic lunge position, so my hip underneath my knee, knees underneath my foot, all nice and straight. So with this, we're just going to push forward at the hip and stretching through the hip flexors. You can hold that for 15 seconds, or if you're doing a dynamic sort of warm up, you can pulse, and that's stretch. No alternative to take your arm over, and then you can also incorporate a stretch through QL as well. And if you've got the balance, you can bring in the quadriceps. Oh, I can get the balance today. And also stretch them as well. It's a great stretch. Just working on that. And because these muscles focusing on the hip flexors, so focus on the main ones at this point, so iliopsoas, iliacus and psoas, and also rectus femoris. There's also TFL and sartorius, but we're going to focus on those main three at the moment. So by those coming tight, getting tight, sorry, they can also cause a reciprocal inhibition of the opposing muscles. So by those getting tight on one side, hip flexors, they can also inhibit hip extensors. So especially glute max can be a muscle that gets inhibited quite easy from that problem. So any sport that requires running or weightlifting, so explosive movements of the hip into hip extension, the body can actually shut down the activation of those prime movers, so shut down how much glute max will actually contract due to there being a limited range of movement through that hip joint, which can present as a problem due to strain injury, or even in kicking sports where, say, AFL or football, whenever they've got to go up to kick the ball, so they'll be going into that lengthened position and then have to contract, so that can cause strains and muscle tears when they go into such a powerful dynamic movement as a kick. So how can we assess that? Just going to do a basic, it's called a modified Thomas test. So it's easy to have someone to assess you, or if you get someone like a mate or a gym buddy, they can help you with it as well. So just put our backside just on the edge of the table, just on the edge, and bringing both knees in. So it's easy to have someone to assist you on the back, on that back position. So what I'm trying to do here is posterior tilt my pelvis back, and that will result in me flattening out my lumbar spine, so trying to flatten out the lumbar area. So dropping the leg that I'm going to test. So for this I'm looking for about a horizontal with the table for the one joint, so iliacus and psoas, and then for the two joint we're going to focus on the knee. So mine doesn't look too bad. I think it's about, can't tell from this angle, I think it's about probably 80 degrees or so. I'm a bit tight through my rectus femoris anyway. So where a test would be positive is if the thigh was raised, that would indicate I've got tightness through, say, iliopsoas, and then if my knee was kicked out more so, that indicate I'd have tightness in my rectus femoris, my two joint hip flexor. But it can be a variation of two. It can be raised or it can be lowered with the leg kicked out, which will indicate one or the other or both. So, and then just sitting up and repeating it on the other side of the leg, and see if there's any differences between each side, which you may have or may not have. So that's something simple you can do. So just focusing back on it again. Stretch first, and then we can strengthen second. So, as I just said before, hip flexor stretch, and then work on your glute activation exercises. So your glute bridges, which help also. So, you may not at this point be suffering from lower back pain, but besides that, can actually cause other conditions like you might you might sort of notice you get an anterior hip pain. So you're getting pain in the actual front part of the hip joint. So what's happening with that is that hip flexors, hip flexors are getting tight. That's tipping the hips forward. And as I said before, that's going to cause reciprocal inhibition, to the hip extensors, so inhibit glute max. And because glute max actually posteriorly pulls the femur back in the joint, if that's getting inhibited, the head of the femur is just going to keep smashing forward in the hip joint. So that's where you could get stuff like an anterior hip pain also. So that's something simple and easy you can do. Just to rattle off some other things, people who have that same sort of problem where they get increased lordotic curve in the lower back, get other things like spondylolisthesis, where the vertebral disc will actually compress and shift forward, which can lead to neural impingement or quite severe lower body pain, and usually result in having to get some discs in their back fused. So we don't want that. So that's something simple you can do. You can check. Besides that, it will also affect the rest of the kinetic chain. So fixing the hips can also result in fixing other problems that you might have with your knees or further up your kinetic chain. So I hope that helped, guys. If you have any questions, just post them below. And thanks, guys, and catch you next time.